So your breast and other implants might be linked to autoimmunity and cancer. Sorry to burst your bubble, but your implants, and not just breast, may be causing or contributing to certain autoimmune diseases and cancer. So what are your girls to do? Not all is lost. Stay tuned to learn more about why this is happening and some things you can do to protect yourself. After assurance from breast implant makers that concerns about silicone leaks were a thing of the past, more than 10 million women worldwide have received breast implants in the past decade alone. In the last 20-30 years, this number is even more staggering. Despite the repeated assurances by the manufacturers, there is a growing body of research, supported by increased symptoms reported by women, linking silicone breast implants to autoimmune disorders and a rare form of immune cancer. Now, doctors commonly advise potential breast implants candidates that the risks are minimal, yet multiple recent studies indicate otherwise. However, there are things you can do to reduce your risks, so stay tuned. A recent study at the University of Alberta comparing nearly 25,000 women with breast implants to nearly 100,000 without them confirmed that nearly 1 in 4 implant recipients is at increased risk of developing an autoimmune disorder. The most commonly associated autoimmune disorders include Sjogren's, systemic sclerosis, and Sacroidosis. Not fun ones to have, although none of them are. The risk for women with breast implants developing an autoimmune disease is about 45% higher than those without. While former studies on the topic have been criticized because they were based on self-reporting by subjects, this study used doctor-based diagnoses to confirm the results. This is a pretty significant difference. Not that patient symptoms don't mean anything, it's just more of a difference between subjective and objective findings. Previous research has also found surgical mesh implants used for gynecological or hernia repair may be linked to autoimmune disorders as well, such as rheumatoid arthritis and lupus. Additionally, patients with allergies prior to these procedures were significantly worse afterwards. This may give us some clue as to why this may be happening as well. For example, if someone has a food allergy and they are unaware of it, yet they continue to eat that food allergy, let's say wheat or gluten for example, this makes it even more likely that they might develop a leaky gut situation, predisposing them to autoimmunity. So these last two findings, especially with the other surgical implants, indicate that there's a little more going on than just breast implants alone. It could be the trauma of the surgery, the fact that there's a foreign body in your body, the anesthesia, or etc. Or more likely it's a combination of everything, topped off by the fact that they are silicone. So in the Alberta study, the strongest links were shown between silicone implants and these autoimmune conditions. Sjogren's syndrome, an autoimmune disorder of the salivary and tear glands, Sacroidosis, an autoimmune disorder of the lungs, skin, and lymph nodes, and systemic sclerosis. This is an autoimmune disorder of the connective tissue affecting the skin, the arteries, the visceral organs, such as the lung and the kidneys. So the theory behind these findings is that the foreign material of the mesh and the silicone implants causes an activation of the immune system. The body continues to fight the invader over time, and autoimmunity develops. Again, this is more likely if you already have other health conditions as well. So like I said before, this begs the question, what about other types of surgical implants? So here is food for thought. I've seen multiple patients with autoimmunity after all types of surgeries, from knee, hip, and shoulder replacements. I've also seen patients develop allergies and or toxicity to the metals used in the implants, not just breast, primarily metal ones. In the largest ever long-term safety study of breast implants, a similar study this year at the University of Texas and the Anderson Cancer Center linked silicone implants with higher rates of Sjogren syndrome, rheumatoid arthritis, scleroderma, dermatomyositis, and melanoma. In addition, individuals with breast implants are also increased risk of developing a breast implant large cell lymphoma, or BIA-ALCL. This is not just breast cancer, but a form of non-Hodgkin's lymphoma, a cancer of the immune system. There are a lot of lymph nodes in and around the breast tissue and in the armpit. So this really kind of makes sense, unfortunately. In most cases, BIA-ALCL is also found in fluid and scar tissue near the implant. However, there are some cases where it spreads throughout the body. Now, the FDA states, quote, "At this time, the most data suggests that BIA-ALCL occurs most frequently following implantation of breast implants with textured surface rather than those with smooth surfaces. Plastic surgeons have identified 615 cases of BIA-ALCL worldwide, with the disease occurring at higher rates among women with textured implants. The French authorities have recommended against the use of textured implants due to the cancer risk. At present, however, the risks are difficult to determine due to significant limitations in worldwide reporting and lack of data. So this lax reporting rules are at fault for lack of patient awareness. Prior to 2017, the FDA allowed breast implant companies to report breast implant injuries as routine events that did not require public disclosure. This is similar to other health-related issues that I prefer not to talk about because I don't want to get in trouble. This effectively kept the information from the public and may have skewed opinions on the safety of using them. In 2017, reporting rules were changed and reports of injuries soared. At the current rate, they are slated to increase more than 20-fold in the last 2 years from the previous 2-year period. According to an ICIJ analysis of the FDA data, after the rule change, the number of suspected breast injuries skyrocketed from 200 to more than 4,500 in 2017 alone. In just the first half of 2018, that number almost doubled to more than 8,000 filed reports. This increase in reports doesn't mean implants are suddenly going bad, but maybe that they were never as safe as they were told, or we were told they were, which I'm sure is probably the case. Most things that invasive aren't as safe as they say they are. The FDA has acknowledged the transparency issue regarding the undisclosed injury reports and that the increase in numbers reflected the change in reporting rules. So the FDA warns that as many as 1 in 5 women who receive breast implants will get them removed within the decade due to complications such as rupture, deflation, and painful contraction of scar tissue around the implant. But there is currently no warning about autoimmunity, and there should be. Maybe one day there will be, but I wouldn't hold my breath. The good news is that in response to the new information, the FDA and agencies around the world acknowledge that more research needs to be done to determine the autoimmune and cancer risks of implants. While these studies do not prove breast implants cause diseases, they do show that women with implants suffer them at significantly higher rates than women without implants, which I alluded to some of the possible causes before. It is also proposed that bacterial infection of a biofilm that surrounds the implant is likely the cause of implant-related illnesses, including the BIA-ALCL, which is something that may be helped with a natural functional medicine doctor. And if you've seen my other posts on the biofilm in the gut, you know what I'm talking about. So if you haven't, check them out. So patient advocates have proposed rules that require breast implants to be sold with black box label warnings, which are reserved for life-threatening and other serious risks. That's pretty major. Undoubtedly, it will take much larger and longer studies to root out the details and bring about protective actions. And in the meantime, doctors and patients need to have deeper conversations about the benefits and risks of silicone breast implants. So functional medicine is about making your body function better. There's a multitude of different things you can do to prevent and in some cases maybe even reverse autoimmunity. If you need some help, give my office a call. In the meantime, some things to consider to help prevent these issues if you have implants or are considering them. Number 1. Get a full workout by a functional doctor to make sure your body is functioning at 100%. Number 2, make sure you don't already have toxins built up and support your body's ability to detoxify. Number 3, consider food allergy and food sensitivity testing. Pretty easy. Number 4, look at healing any gut problems you might have so you don't develop leaky gut and thus autoimmunity. So keep this in mind, which I've said before, correlation does not equal causation. But if it walks like a duck, quacks like a duck, you know the rest. I'm Dr. Craig Mortensen. Be healthy, be happy.